In perimenopause, we have a roller coaster of hormones. And I have always many women saying to me, like, when I'm thinking about perimenopause hormonal issues, also my gynecologist said, you're way too young for that. And this is actually something we have to always also remind my colleagues, that it really affects women between 40 and 50.
But it's perfectly normal and healthy for you to go through the perimenopause and to hit menopause without a super muscly body. Exercising, will help you in so many ways. It will help you manage depression and stress and everything else. But it's not about that. There is more to it than just looking good. If you're incontinent, then you're less likely to exercise, and that might drive depression, that might drive weight gain, and you basically have one thing leading to the other.
Like 20% of women in perimenopause, they did not go for a promotion they would have otherwise gone for, and even 12% of women resigned, 19% reduced working hours. So I think perimenopause is also affecting economics and our careers, and so it's really important to have a look at all the factors.
Glad to have you all on board. It's about the time that nobody talks about, which is called perimenopause. So briefly, I will just tell you who we are. Miyara, who is hosting today's session. We are a women's health platform, and we want to be your guide to midlife health. We give science and evidence-backed health information to support women through the midlife, especially perimenopause and menopause. We work on these different aspects. We think it needs to be a holistic approach where you're talking about nutrition, health, physical fitness, going for your health check, screening, mental health, mindset, sleep, hydration, and much more than this also. When I say we, I'm talking about myself, that's Dr. Gayatri Muthukrishnan, and Dr. Sanjana Rao, who's also on this call. Hi. And what we do provide is health information in forms of blogs, newsletters. We run these webinars and provide resources. We do have corporate awareness and sensitization workshops. We have a set of products that we are partnered with on our website, which includes at-home tests, and we run customized wellness programs. So that's briefly who we are. And now I would like to introduce our speakers of today on this, who are here. I'll start with Dr. Tina Bernardi. So one thing that she said that really was impressive for me is it's very important for me that women feel comfortable and properly understood, and that all concerns, no matter how big or small, are taken seriously. And this is, okay, so who's Dr. Tina Bernardi? She's a specialist in gynecology and obstetrics with many years of professional experience. A little more about her, she was a chief physician at the Seespital Horgen, and she headed the Monvia Health Centers in Wallisellen and Winterthur. Right now, Dr. Bernardi offers her patients competent and personal advice and care in the entire field of gynecology and obstetrics. She consults at her own place in Thalwil. And the other side, we have Viviane Hoeger.
Hello.
Hi, Viviane. She is based in Horgen. She's a qualified personal trainer, for a pelvic floor specialist, and a nutrition coach. She's passionate about helping women feel strong, confident, and empowered in their lives and in their bodies. And this is why we have the two of them here today, because both of them are passionate about women's health, and we are here to talk about that. So let us start to the burning question of the day. What is perimenopause all about, and what are the symptoms that we're talking about today? Dr. Bernardi?
Hi, yeah, so I'm happy for the invite and happy to be here. And yeah, I, like a couple of weeks ago, I also did like talk to some doctors. So some of the pictures I show are from that doctor's talk. So you don't have to read everything, and it's also in German, but I will once in a while show a slide of that. Yeah, perimenopause. So first thing is like always to think what is it? So also health professionals can be a little bit getting confused with menopause, perimenopause, postmenopause. So roughly said, menopause is really when we have our last period. And this is, we can only say retrospectively. So if we have not had any bleeding for 1 year's time, we can say like 1 year ago, we went into menopause. And after that, we are postmenopausal. This is not really what we are talking today. Today, we really want to focus on perimenopause. And this really happens 4 to 8 years before menopause. So 4 to 8 years before we have our last bleeding. So at least in Europe, the average age of a woman to have the last bleeding is 50 to 52. So perimenopause affects really women between 40 and 50. And I think this is also important to know that actually we all feel young. I'm also between 40 and 50 and I don't feel old at all. And I have always many women saying to me, like, when I'm thinking about perimenopause hormonal issues, also my gynecologist said, you're way too young for that. And this is actually something we have to always also remind my colleagues that it really affects women between 40 and 50. And the postmenopause is quite easy because our ovarian activity kind of reduces or stops completely. So we don't have much of hormones anymore. Whereas in perimenopause, we have a roller coaster of hormones. Now you see it? Oh,
yes.
Okay, so here we have the puberty with the roller coaster of hormones, then the regular cycles in our fertile years. Now it all, and yeah, then the perimenopause. And we can also see it here again. This is what our hormones do in perimenopause. So sometimes, like in one cycle, it can be like a complete, yeah, sometimes we have very high estrogen levels, then suddenly they drop down to almost zero. The progesterone is more or less low, so we have a lot of imbalances. So perimenopause is basically about imbalances of hormones, not so much about a lack of hormones. So, and I think this is important to understand for the symptoms. So if we have very high estrogen, we will experience breast pain. We will have severe bleeding because the lining in the uterus builds up very high, and this all has to come out when we menstruate. We have water retention, which can lead also to a weight gain. And also like our mood can be like a little bit like aggressive. Then if estrogen drops, suddenly we feel depressed. We have hot flashes, we are sweating, and also brain fog. So it's hard to concentrate. And the lower levels of progesterone, they lead typically to sleep problems. So we really have problems of sleeping through, which of course doesn't really help to with depression and brain fog. It makes it worse. Then we have shorter cycles, irregular cycles, spotting, mood swings, and also anxiety. So anxiety is also very much linked to the low progesterone. So these are all possible symptoms of the perimenopause. And we should never forget that also perimenopause hits us at a stage of life where we generally are having our, let's say, midlife crisis because our children are growing up. We want to focus again on the career. We might need to concentrate on our marriage, and we look back because half of our life has already happened. So we might look back and say, what did I do with my life? And this can also lead to a psychological crisis. And you can imagine if you already have that psychological crisis and then you add a roller coaster of hormones on top of that, this will not help with everything. So perimenopause has many aspects. It's not only about hormones.
Yeah, that's so true. The whole midlife health is we need to look at it through all lenses. Viviane, just coming to you.
Yes.
What do you what problems do women in the midlife, like say late 30s to early 50s probably, what kind of problems do you see them coming to you in terms of lifestyle interventions?
Yes, I mean, as I work in fitness and nutrition, of course, women come to me because they notice perhaps that they're having a harder time keeping a healthy weight, or they've noticed perhaps that they're not as toned, or that they're having a hard time basically maintaining their muscle mass if they already work out. So I see, yes, of course, they don't come to me with the symptoms that Dr. Bernardi just described, but these are also a consequence of the hormonal changes and the changes that happen in the body in the perimenopause, right? So we know that the hormones play a role also in our ability to build muscle, to keep muscle. They play a role also in sometimes they also play a role in in where we store fat. So research in this area is still quite recent, but we know, for example, that our reproductive hormones, they for some reason they heat our bodies. So when we talk about perimenopause, we know, for example, that we're not as basically productive at burning calories as we are in earlier years. So that could be one reason to explain why some women notice that they gain weight, or they have a harder time maintaining their weight. That we lose muscle mass. Of course, hormones play a role there as well. Also, the fact that as we age, unfortunately, that is a consequence of the aging process, that we start to lose muscle mass. So a lot of the women coming to me, they're concerned about how they look, basically, their weight. And I've got to say, though, it's normal for our bodies to change, right? Our bodies are changing all the time. They're never the same. I mean, it's enough of a roller coaster, and then you know, it's no wonder this is a difficult process. I mean, Tina literally showed, you know, the spikes and the drops. It's no wonder we feel sometimes the way we do. And of course, noticing that even though you're eating correctly and you're exercising, if you're still not, you know, if you still don't have a feeling that that you see change, it can be very frustrating. So I see it, women who are quite frustrated by the process. But again, our bodies are changing all the time. It's completely normal. And if I may add, I think it's great that we see nowadays also women out in the media talking about perimenopause and menopause. But I also feel we have to be a little bit careful with the image that they're putting out there. It's perfectly, I mean, kudos to them, you know, for having a six-pack and bulging abs and all of that. But it's perfectly normal and healthy for you to go through the perimenopause and to hit menopause without a super muscly body. I'm not trying to discourage women from working out, far from it. I think, you know, keeping exercising will help you in so many ways. It will help you manage depression and stress and everything else. But it's not about that. There is more to it than just looking good.
No, that's so true. That's so true. And we will be talking about how we can navigate this right now. We will get to that. Yeah. So starting with Dr. Bernardi, how a woman who's going through, now that we have discussed that these are the symptoms, it's one thing that women need to realize that probably it might be gynecological and hormonal, but how do they navigate? Like, say a woman starts having certain symptoms in late 30s, early 40s, or mid 40s. What should they do about this?
Well, they should really also see their gynecologist, and then let's hope that the gynecologist knows about perimenopause and listens. So we always have this feeling we go to a doctor, the doctor takes blood and makes a diagnosis. And this is okay for postmenopause, because if we take our hormones, we will see that there's basically very low hormonal activity. But for perimenopause, if we take the hormones on one day, we might have 3 times higher estrogen levels than normal. And if we take it a couple of days later, maybe our hormones, like estrogen, is down to almost nothing. So the hormonal tests really, unfortunately, they don't help. But if we listen, as we doctors, if we listen to the symptoms, I mean, I described the symptoms, so we can relate the symptom to the hormone. So, for example, the brain fog is definitely an estrogen thing. So, because estrogen is protective for the brain cells, and changes that we have, like high levels, low levels, they cause also a irregular activity in the brain. And this also causes problems with concentration, with mood, also the temperature regulation. So if a woman explains that to me, I know that that she really must have hormonal ups and downs of estrogen. The sleeping, it's about the progesterone. So if she says, I have no problems falling asleep, but then in the night I wake up, I cannot fall back asleep again. So I can relate that to the progesterone. So listening to the symptoms can help me to make also the diagnosis. So it's very important to maybe also list your symptoms. So we all have our cycle apps, I guess, and usually we only use them to put in the first day of the period and the last day of the period, and maybe also the heaviness of the bleeding. But those apps, usually they can also do more. You can also write down your symptoms. You can also see if they're related to your cycle. And this also helps a little bit to find out about the hormones.
Yeah. No, that's really true. Do you also, is there any nutrition, apart from hormones, is there anything else that happens for the women during the stage in terms of their vitamins and others? Do they need other supplements? Do those help in any way? Dr. Bernardi, sorry.
Yeah, so I thought that was a nutrition question. I mean, for the hormones, of course, for the estrogen, we have many herbal or these phytoestrogens, like soy, for example. But of course, we need very big amounts of it, so they can really help. Also, like the yams has progesterone. So I guess Viviane can answer that more specifically.
Sure.
Yeah, so there are different foods that are rich in phytoestrogens. So we know, as Tina said, some soya products, so tofu, sesame seeds, pomegranate. I think we discussed this earlier. So berries, you have the cruciferous vegetables, so broccoli, Brussels sprouts, so vegetables from that family. You have foods. These are these phytochemicals. They act like estrogen, right? They're but yes, I think it's they belong in a healthy diet in any way. But it comes with a small caveat that we need more studies in this area, basically, of how effective they are. As Dr. Bernardi mentioned, it the dose makes the difference. We don't know exactly how much, but in any way, these are all things that belong in a healthy diet. So I think there's no harm in adding these to your diet. Yeah.
Okay, no, that's good to know. And sticking with you, Viviane, the question I have is now, if a woman goes to the doctor and gets this diagnosis that she's in perimenopause and this is what her health is going through, does any of this diagnosis or help you as a trainer and a nutrition coach? How does it help you to help the women? A report from the doctor?
Of course, it really depends on the diagnosis, right? I suppose, and Dr. Bernardi can correct me here if I'm wrong, but one common issue in perimenopausal women is also, it's insulin resistance. They notice that, they're not able to regulate their blood sugars. If that's an issue, of course, I can help with. If they've noticed that they have a little bit more, let's say, abdominal fat than what's considered to be normal levels, I can help with that as well. It really depends on what their issue is. I can definitely help, of course, through exercise with ensuring that they can maintain good bone density through strength training, and that they just feel, stronger and healthier. And exercise doesn't help just with the physical aspects, right? It helps a lot. I find that a lot of my clients, I normally joke with them, I'm half personal trainer, half psychologist, because they really come for the session, and it's often more than just the training. It's also the hour what they have to, just talk about how they're feeling and it's lovely to see when they finish how most of them anyway feel energized. They feel like, oh, when I woke up this morning, I really didn't feel like coming and exercising, but I feel much better now. So it's about all those endorphins, the feel-good hormones that we release through exercise as well, right? So
yeah. No, that's so true. Like I said, it's all interconnected in different ways: the hormone, the fitness, the nutrition, and the mind. Ultimately, it's
all connected. Yeah,
yeah. And we were discussing the different factors that affect one in the midlife. Do you want to say something more about it, Dr. Bernardi? Because you started talking about the different social changes, and do you have anything more to add about the mental health, the social changes, and the physical changes that affect the woman at the same time?
Yeah, I mean, they all are linked together. And also, as Viviane said, that also the muscle loss, of course, we burn less calories. But on the other hand, if we are feeling depressed because of hormones, because of midlife crisis, we also usually don't go out and exercise. So also this depression leads to a lack of exercise, which also makes depression and weight gain worse. So it's also a vicious circle that we somehow have to go get out of. And yeah, it's also interesting because also, like, of course, our career life is affected. So there was actually a study in October last year from, I think, like a finance company, and they found out that like 20% of women in perimenopause, they did not go for a promotion they would have otherwise gone for, and even 12% of women resigned, 19% reduced working hours. So I think perimenopause is also affecting economics and our careers, and so it's really important to have a look at all the factors.
Yeah, and sticking with you, just one question. Sorry, not last question, but one question. So we are talking about these lifestyle interventions, but are there medical interventions, and at what point do you start getting into the medical interventions?
So it's always seeing what is the main problem of the woman. So, for example, sleep deprivation, and which might also have an effect on your work life. I tend to go quite fast to substituting progesterone. If it's other things like weight gain, I would more not start with hormones. I would more send some to Viviane, for example, for this. So hormones can solve problems, but there are also many other things that can do. And as it's like a multifactorial issues, we can also not expect that once I take my HRT, I'm thin, I'm happy, I will go for the career. So that's also not how it works. So we always have to figure out the quality of life and see what brings you there. And of course, we also have to rule out other things. For example, thyroid problems can also make symptoms similar to that. So we should always also check the thyroid and also other things. So yeah.
And one last point of discussion before we get to all the questions. There are lots of questions I can see already on the chat. Is the vaginal health and pelvic floor health. So how, so what happens during this time in terms of vaginal health and pelvic floor health? First, we'll talk about it medically, and then we'll just talk about how Viviane helps these women through this issue.
Yeah, so one important thing, of course, for the pelvic floor is pregnancies. And actually, it's about the pregnancy per se, not so much about how we give birth. So in long term, it's the number of pregnancies and the weight that was on our pelvic floor. So if we are like 9 months pregnant, we have at least like 2/3 of that, we have a certain weight on our pelvic floor, which already makes problems. And we give birth, and of course, if we have vaginal birth, we might like have a short period where the pelvic floor is very weak, but then hopefully we all do our pelvic floor recovery training, and then it's getting better. But then when we age, then we will also have like all the soft tissue getting weaker. And then it's really a matter of how many pregnancies we had, plus a weak tissue. And then if we also have a weak pelvic floor, this all leads together to problems with incontinence, because our bladder, it doesn't have like a closure like our anal sphincter has. So the anal sphincter is like one muscle that we can contract, and then we are continent for stool. So for the urine, we have the bladder, the urethra, and the pelvic floor and the surrounding tissue, they close the urethra. And if these are getting weaker also by aging, then we can, for example, if we cough, if we sneeze, we cannot keep everything closed, and then we lose urine. And also the vaginal dryness keeps all the tissue very thin. So all this plays an impact, and the older we get, the more problems we can experience.
Mm-hmm. Yeah, Viviane, do you want to take it from there and explain a little more?
Yeah, absolutely. I think what most people, I suppose, fail to appreciate is that the pelvic floor is mostly muscle. And like muscle in the rest of our body, it ages, it thins, as Dr. Bernardi said. And I think our biggest enemy there, as far as keeping the pelvic floor healthy, is it's a lack of movement. Yeah, it's being a sedentary lifestyle. I think that will definitely have a big impact in your pelvic floor muscles as well as you age. And the best thing we can do is basically to stay active. Of course, we have to be a little careful. If you are incontinent, then there's definitely types of exercise that you should and that you shouldn't be doing, right? But for most women, the good news is for most women, with a little bit of hard work and some pelvic floor physiotherapy, these muscles can become functional again. They can become strong again, right? And we also have to be a little bit careful with the type, the Kegels doesn't work for everyone. It's important that women, before they do anything, that they go to their gynecologist, that they get properly examined, that we know what we're dealing with. If they are impacted by incontinence, what type of incontinence is they're suffering. So there are lots of factors in play. Once we know these things, then it's a matter of putting in a little bit of hard work. It's activating those muscles. It's thinking that it's not just, my arms or my shoulders or my back muscles that need a little bit of work. It's also those guys down there. Yeah.
True. It's just about thinking about them to begin with, that they exist, and then you need to work.
They're not muscles that we can show off, right? We can't just go check out how strong my pelvic floor muscles are, or I've been working out, so they're really tight, but they shouldn't be forgotten. I think, continence has such a huge impact in our physical health, in our mental health. We shouldn't underestimate it, right? It has a huge impact. And it goes back to that circle that Dr. Bernardi was talking about. If you're incontinent, then you're less likely to exercise, and that might drive depression, that might drive weight gain, and you basically have one thing leading to the other. So it's I suppose what I want to say is yes, it's common, but it's not normal to leak when you don't mean to. And there's help out there. You don't have to suffer in silence. You don't have to accept it as part of aging. It doesn't have to be a part of aging.
True. And we should not forget the impact of our pelvic floor and sex life. Because
absolutely,
you cannot show off your pelvic muscles in certain situations. You can.
Absolutely.
No, that's very important, and I'm happy you brought that also up. Because it's like you said, we don't think about it, and it's also something that women suffer in silence. It's one of the things. And it's important they talk, even for social situations. You might not go on long trips or things like that also start getting affected if you have the pelvic floor issues where you, like a hike or a trek, and you know that you don't have access to toilets very often, and then it starts becoming.
I also don't think, I think we need to be careful also that we don't normalize something that shouldn't be normalized, right? I know from quite a while ago, I watched this video of some women doing CrossFit. For those of you who don't know, CrossFit is a high impact, high intensity exercise form. And they were filming these women doing CrossFit competitions, and you could see that there was urine underneath them as they were doing box jumps. And the filmmaker was really trying to make light of it, and the women were being interviewed, and they're like, "Oh yeah, it happens." And I was horrified, I must say. I am still horrified that I had to. This was out online trying to tell women, "Hey, it's okay. You don't have to be embarrassed." And I'm not suggesting you should be embarrassed. Of course, no one should be embarrassed about incontinence, but we have to be careful also not to make something like that seem that it's okay. It's normal. Yeah.
It has to be taken care of.
Absolutely. I think fitness is important, but the type of fitness comes with a caveat. If you are incontinent, you have to manage what you're doing very carefully.
Yeah, no, that's very important. Thanks. I'll straight away get into some of the questions from the audience. So there's one: how to gain muscle mass and strengthen bones?
So that is the benefit of doing strength training, right? So you strengthen muscles by doing strength training, by working with resistance, either weights or your own body weight. Basically, it's slightly different from cardio, where you work more your cardiovascular capacity. By doing that, you are already improving your bone density, bone health. So it goes together. Yeah, so a short answer is doing strength training in some capacity. Yeah.
And for bone health, but for bone health, of course, it's also important to have enough of vitamin D and calcium intake.
Absolutely. Yeah.
I was just going to ask about that, the vitamin supplements that you need for that. The next question is about.
I have added the questions to the file, Gayatri. Maybe you want to look at that. Yeah.
Okay, I'm just reading. What about women who are taking hormone blockers due to breast cancer? What can I do to help my body with low estrogen levels, as I am not able to take any hormones?
Yeah, I mean, this is true. If you have hormonal dependent breast cancer, you cannot take like the HRT. So for short terms, if you have like vaginal dryness, for example, for short terms, and of course with supervision from your gynecologist, you could use local estrogen in the vagina, but not for long. But if you have like very heavy issues, you could do that. And there are also the phytoestrogens that you can try, but yeah, it's definitely not as effective, but it's better than nothing. To try those also as supplements in your food, also, or even vaginally.
Yeah. This next question is for Dr. Bernardi. What about the impact of working night shifts? Not only a perimenopause problem, of course, but difficult to take patients off. Is the question about how does it affect the hormonal changes, the night shifts, working night shifts?
I mean, working night shifts affects generally our whole like sleeping cycle, and of course it will also affect like the hormones it can put on stress. Also, if you don't have enough of sleep during the day, then you might go also into sleep deprivation. Yeah, so this is also why usually you should not change your schedule with night shifts very often. Also, you should have certain night shifts in a row and not change from day shift to night shift. But yeah, it's a general health problem, working night shifts. And of course, it also affects cycle and hormones and the other way around.
Yeah. You see higher incidence of insulin resistance in night shift workers as well. So it's thought that it's to do with our normal day and night cycle and how that impacts not just the decisions we make when we eat, but also how your body processes those calories if you're eating outside of the normal day hours. There's
What about migraine? Is it linked to perimenopausal phase? Is it true vitamin B1 helps?
So there are many different kinds of migraines. If you have a hormonal influenced migraine, of course, hormonal imbalances can worsen it. But of course, there are also other types of migraines that are not necessarily influenced. And vitamin B generally is good for our nerves, but also magnesium is very effective with migraines.
Oh, okay. And when you say it is, if it's related to the hormonal issue, how do you know, how would you identify if the migraine is something to do with your hormonal cycle? Is there a way of identifying that?
Yeah, I mean, usually those women, as long as they had like their regular cycles, they might have noticed that the migraines get worse when they have like shortly before the period, so in the second half of the cycle. And also if you're on the pill, so some women also experience more migraines when they have the break of the regular pill because of the lack of estrogen. So in your lifetime, if you have a hormonal dependent migraine in your lifetime, you will have noticed it at a certain point. And of course, also the cycle app can help to discover that.
The tracking, yeah. So there's a few more questions here. One is on the bleeding, if there's extreme bleeding in this age around 42 with short 3-week cycles, 2 weeks bleeding, 1 week no bleeding. So if there's extreme bleeding, I think the main question is if there's extreme bleeding, what should they do? Because they've heard that during perimenopause, it's usually scanty bleeding. So what about the extreme bleeding?
I mean, first get an ultrasound to just rule out that there's like some physical thing like a polyp or whatever. And otherwise, as I said, it's like the high estrogen levels that really make the lining in the uterus grow very thick, and this all has to get out. If you don't want to go for like hormonal therapy, there's also effective medication that helps also to reduce the bleeding. So this is definitely something you can look into with your gynecologist, also like the hormonal coil. So there are quite many options actually for severe bleedings.
Yeah, so that comes to one question about contraceptives. So how should women work around the I mean, this is a question that I'm just asking from the discussion. They should still be on contraceptives through the perimenopause, and when do they go off it? So if you can just talk a little bit of how they should work with the contraceptives during this time.
So, I mean, as long as you ovulate, you can get pregnant. So as long as we are not postmenopausal, it might happen that we get pregnant. Okay. The risk of miscarriage is very high. So it might not end in a healthy pregnancy, but also we don't want to go through miscarriages. So yes, contraception is needed. And if you are on hormonal contraception and you tolerate it well, there's the option just to continue with it. And then the official recommendation also is to continue until 52, 55 and stop it only then. If you stop hormonal contraception before that, you might certainly hit these very heavy and irregular bleedings. So if you're healthy, under medical supervision at least once per year and tolerate it really without any side effects, it's also okay to continue with it.
Oh, interesting to know that. Okay. And there's one more question here about perimenopausal phase is hard in many ways due to hormonal surges and falls. What are the issues women have to deal with post-menopause? For example, say 3 or 4 years post their last periods.
So we make a whole new chat about that. So just like shortly said, then we have low estrogen, low progesterone, and then we have these typical hot flashes, sweating, dry vagina. So we don't have these imbalances anymore. It's like a continuously low hormones. Also, like testosterone levels are very low, which can also have problems with libido and these things.
So is there something, so what do you usually recommend for postmenopause?
It depends. So if you are not suffering, I mean, there are women who don't suffer, so I don't recommend to do anything. And if you suffer, there's also herbal treatments, acupuncture, and HRT.
Okay. And Viviane, do you get women coming postmenopause? And is that
And I do have a couple of clients who are postmenopause at the moment, and they're and they're sorry, go ahead. You had
No. So is there something? Do they come with specific symptoms, or just that you just do some specific training because of postmenopause? Do you do any specific training?
No, to be honest, both of the clients that I have, they were fit before, so it was just about staying fit. Yes, and they're not super keen on high impact stuff anymore, which I understand. You know, sometimes it's okay. It doesn't have to be that way. And no, they're coming to me basically to stay fit and healthy. So I can see that one more question popped up for me actually. Since I'm talking, I might as well address it.
Yeah.
And just on the top, someone talking about, yes, it can be an economical problem, of course, if you don't have the choice as far as working night shifts. And what I can say is, I think managing stress is very, very important. So if you are working nights, it's important that, and I think Dr. Bernardi touched on this as well, that during the day that you do make enough time to sleep, and also and having, then paying even more attention to how you're eating and what you're eating, of course, right? It's managing those blood sugar highs and lows, which will definitely be different if you're, let's say, sleeping during the day and then having meals later in the day. There's some interesting studies out there that show that the later in the day we eat something, our body reaction to what we're eating exactly is completely different. So they actually tested out someone eating, I think it was a piece of chocolate in the morning, in the afternoon, and in the evening. And very interestingly, the exact same food in the same amount had a different body reaction. So we know that is a fact. And as far as mitigating this, it's a tricky one. I would say then do the best you can for when you are having your meals, then you're conscious of the fact that, we need to be focusing on healthy carbohydrates, so wholesome carbohydrates and good fats, good amounts of protein. It is everything that you can. Yeah, I do get that it's not everyone's choice to work during the night, but then stress management and making the most of the time the sensible choices as far as nutrition is concerned will help.
Yeah, it's good. I hope that answered your question.
If not, do be more specific then. Maybe.
Yeah. And you can also unmute yourself and talk if you want to.
Yeah, absolutely.
So the other question, how to work on pelvic floor muscles, if you want to go into a little more details on how to work on pelvic.
So we have the very basic Kegels, right? That became famous. These are exercises that focus on, they isolate the pelvic floor muscles basically. And I think there is a place for Kegels, definitely. And if you're experiencing incontinence, they're a good way for most women to learn how to first find those muscles, identify them. And also by focusing on them, of course, we have the ability to strengthen. Depending on the exercise you're doing, you're even able to target specific muscle groups. So more around the anus or more around the vagina. It's quite interesting, actually. There are really only two types of Kegels. You have the short contractions and you have the long contractions. And that's linked also with the different types of muscle fibers we have in our body. So we have the fast twitch muscle fibers, we have mixed twitch, and we have the slow twitch. So
Okay.
the exercises are based on the fact that when we do the short contractions, we want to activate those muscle fibers that are responsible for a quick reaction. Let's say when you sneeze, when you cough, yeah, we want them to be responsive. We want those muscles to activate, to shut down, basically. And the slow twitch, we're talking more about your endurance muscle fibers. So they have to keep you continent also when the bladder is full and you're not in a situation where you can easily reach the toilet. So the long contractions and the short punchy contractions, they're based on this, basically, this idea that we train them for both things, right?
Mhm.
There is more to pelvic floor training than Kegels, though. I always tell my clients that the pelvic floor muscles, they are a part of what we call the core system. So these muscles, they're active with pretty much every movement we do, right? There are some interesting MRI studies that show that even raising my hand, my pelvic floor activates in reaction to the movement. Yeah, it lights up, basically. It's only if I'm doing maybe, crunching my fingers, you might not see anything happening in the pelvic floor, but otherwise your pelvic floor is active with every movement. So it goes back to what I said earlier, a healthy, active lifestyle is what's going to help you also in the long term. But yes, if you are experiencing incontinence, then with the help of, proper diagnosis from your gynecologist or your doctor or a pelvic floor physiotherapist, then we know how to work those muscles. It doesn't work for everyone. I've got to make this clear. I think we can in fact do some damage. If someone who's suffering, for example, from urgent incontinence, it might not be, it's not the best solution for them to be doing Kegels, for example. So it needs to be properly diagnosed.
That's very interesting. So there are different, other than Kegels, there are other basically exercises and ways to work and strengthen those pelvic floor muscles.
Yes, I mean,
Yes.
things like squats or going up on your toe tips. These are all movements that activate the pelvic floor muscles. So it's not just about doing squeezes.
Yeah, no, that's really important to know, because that's the only thing you hear about in the media. You just hear about Kegels and nothing else.
Again, I don't mean to dismiss Kegels. It has
Yeah.
a place in pelvic floor training. It's not all about that.
It's not only about that.
In my opinion, anyway.
Also, relaxation and coordination is super important.
Absolutely.
So we all think we all have to build up very strong muscles, and sometimes I have women who have so strong muscles that even it has a problem with sex, with intercourse, because they are so tight. And then you have to tell them that you have a good pelvic floor and strength, but you cannot relax, you cannot coordinate. So this is also super important.
Yeah,
for flexibility.
For these women, for example, Kegels would be detrimental. They already have, the pelvic floor muscles are already too tight. And then they're not functional, right? Pelvic floor dysfunction is not just about weak pelvic floor muscles. If they're too strong, they're also dysfunctional. So you have both things, yeah. And
this question, do you there are pelvic floor training and physiotherapy in hospitals? Do you know if it gets on the insurance list?
We set up postpartum physiotherapy training for pelvic floor in some of the hospitals. And I think it depends on the professional. You have to be Krankenkasse, so you have to be recognized by the insurance company. So I know I am, for example. So the women who come to me, they can claim money back through the insurance company. But I think it depends on. It's an individual. I don't know how the qualification is done. To be honest, I'm as a person recognized by the insurance companies, but I don't know how it works if you're a program. I would imagine you would have to hold some kind of certification for the insurance companies to. In my case, it's QualiCert. But I'm not sure that's what they mean with the question, but
yeah, I think that's what it is, that it can be covered. It depends on the situation, but it can be covered.
Yes, so most insurance companies will acknowledge if you have QualiCert and QualiTop. These are the two main ones. If you're recognized by them, then the insurance companies will most likely recognize you.
Okay. So there's one question about the cycle lengths. I just read that It also is the increase in number of days between your cycle day from 28 to 40, but regular cycle is a sign of perimenopause. That's a bit difficult because it can be. So why might the cycle be longer? So it might be that you ovulate later. So usually the second half of the cycle is 10, 14 days, the first phase of the cycle where you build, like when your follicle grows, and when you ovulate, this can be longer. So if you have a very long cycle, you most probably have the first phase of the cycle long. This can, but also be like a problem of polycystic ovaries and other things. So this would be also something to have a look into with your gynecologist.
Okay. Are there any other symptoms, changes in the cycle to watch out for during perimenopause? Or is it just the symptoms you already spoke about?
Yeah, so just to summarize, it was like shorter cycles, irregular spotting in between, and heavy periods. So this is basically it.
Okay. One other point that we were discussing, and I wanted to just bring that up, is the whole body image during perimenopause, because you just most of them cross your 20s and 30s, and you still feel young, like Dr. Bernardi pointed out, like you're still young in your 40s. But then there are changes happening to your body. So how do you work on this whole mental aspect of what your body should be like and the whole body image issue in your 40s? Viviane, you want to take it?
I think it's a tricky one because as women, we are, and from early on, we we're put under a lot of pressure based on how we look, right? I mean, even if you look at things like, I remember this growing up, you know, someone was going to take a picture, suck it in, put your tummy in, so you look good for the picture, which, by the way, can later on in life have consequences also for pelvic floor health, right? This idea that we should always be holding it in and pulling our tummies in, and it's not healthy on many levels. And I think we have enough pressure, right, as it is. As I was saying before, it's perfectly possible to have a healthy perimenopause and not to have a flat tummy or, you know, bulging muscles. I would in fact make the argument that you know, too little body fat is detrimental to health. Yeah, we have studies, longevity studies, that show that a certain amount of body fat is in fact has protective effects. So I think when we see the people in the media talking about their experience with perimenopause and menopause, and they look amazing, again, that's wonderful for them, but that's not most women's experience. It's perfectly fine to carry a little bit of fat here and there and to still be healthy and strong. We just need to be careful with the assumption that you have to look a certain way to be healthy or to feel healthy. You don't.
You're on mute, Gayatri. You're on mute.
Sorry. Yeah, Dr. Bernardi, do you want to add something to that? Or?
No, I think that is perfectly said by Viviane.
Yeah. Thanks a lot. I think that's most of the questions answered. Do you have any last things that you want to just say, Dr. Bernardi? Or...
No, I want to thank you for the opportunity to tell a little bit about perimenopause, and I really hope that it gets more in our heads, like in women's heads, but also into professionals' heads, that perimenopause exists.
Yeah. Also, thank you for the opportunity of being here. I really enjoy this. It's nice to be able to talk about the things we're passionate about, right? It's
Yes, it's important, and we would like to thank both of you for coming and giving your time and talking about this, because it's a very important topic to discuss. Like you said, just make people aware that it exists, this life stage exists, but there are ways of dealing with it, and just be aware that that's what is happening, so that you can take the steps required in the right direction for your health.